Hi everyone, welcome to Social Work 506. This is the sequel to Social Work 505. In Social Work 505, as you recall, you'll learn the introductory, basic, generalist practice skills of developing a relationship, building trust with your clients, learning some assessment tools, taking those assessments, and then thinking about how to use things like the change process to guide you in understanding where clients are in the change process, and then using motivational interviewing to help move them along in that change spiral. We talked about brief solution-focused interventions and how to think about beginning that collaborative intervention planning strategy. And so as we move now into the second semester, this is really the springboard for your advanced practice year. We're going to really start to dive into some clinical theories and think about how we use clinical theory to guide us in the intervention planning, and how that theoretical modality that we tend to ascribe to or view things through are really the frameworks around which we take all of the information we gathered in the assessment process and begin to put the pieces of that information together in a way that enables us to think about what are the challenges, how to work collaboratively with our clients to think about some then strategies and intervention planning. We're going to look at cognitive theories, behavioral theories. We're going to look at the psychodynamic theories and psychodynamic tools that help guide us in terms of understanding attachments, understanding self-psychology, looking at object relations, thinking about family theories and family systems theories, and how those things and those elements and components help us understand the assessment process and help us then take that information and put it together in a way that helps us be able to work with clients to develop the most effective intervention planning and treatment planning. And so again, this is going to be very foundational because you'll dive even deeper into clinical theories when you get into your advanced clinical year, but this is just a good foundation to really understand the subtle nuances and the differences in the way theories function, in the way theories are built, that help you really understand then why and how intervention strategies either work or don't work, depending on the way the theoretical foundation helps you to analyze and assess the information that you have. And so I'm sorry that I can't be with you this week. I'm at a conference, and so I'm just doing a brief introduction of our course. Please take a minute to overview and look over the syllabus. I've added a Q&A page around the syllabus in the first week so that you can ask any questions you might have related to the syllabus and the assignments. I'll be sure to try and respond back to them as quickly as possible, and if not, I'll definitely address them in the class when we meet next week. In addition, I'd like you to take a minute or two, since we have a few new people in the class, to introduce yourself. Really talk about some of the things that you learned about yourself as a budding clinician last semester, and then what you're hoping to really start to dive into and understand and think about and learn more from this class in the spring semester. So please post that up in the discussion introductions page in the module 1, and I look forward to seeing you again next week. Bye now.